Hello everyone, my name is Catherine Sofel. I am a registered dietitian and I have a master's degree in nutrition as well. Today I will be going over modified food textures and thickened liquids for patients in long-term care facilities and assisted living facilities. So today's objectives, what we're going to go over, first we're going to go over some background information about dysphagia, what it is, what patients experience dysphagia, and some complications of dysphagia as well. Then we're going to go into some of the diets that are prescribed for patients who do have dysphagia or difficulty swallowing. So the first diet we're going to go over is puree diet. Then we're going to go over mechanically altered, advanced or chopped diet, and then finally we're going to go over the thickened liquids. So dysphagia is not a disease, but a disruption in swallowing function. So it is, reduced ability to obtain adequate nutrition by mouth and a reduction of safety during eating. So swallowing is a complex process. It involves about 50 muscles and dozens of nerves to move food from the mouth all the way down to the stomach. So dysphagia is really a disruption in the whole swallowing process that can occur from moving food from the mouth all the way down to the stomach. And dysphagia can be caused by weak or uncoordinated muscles of the mouth, throat, motor, or sensory deficits, impeding chewing or swallowing. So because so many muscles and nerves are involved in the process of swallowing, if you think about, if you take a swallow right now, think about the process of, putting your tongue backwards and then the whole movement down through your esophagus. So it can be caused by, weak or uncoordinated muscles of any of those muscles that is going to impair the ability to chew and swallow properly. And we actually, fun fact, we swallow about 600 times per day. So not only do we, constantly swallow food and water or any other liquids, but we're also swallowing our saliva, on things that we don't even think about. It's just an automatic process that our mouth produces saliva, and so oftentimes we are swallowing and not even knowing about it. So 600 times per day is a lot of times that you have to, if you think about how many times you're actually swallowing. So it's a very complex process, and so having dysphagia disrupt any of those processes can, cause inadequate, oral intake and reduction in the safety. So dysphagia is an impairment in one or all of the stages of swallowing. So the stages of swallowing begins at the lips and then ends with the food passing into the stomach. So the first phase is the oral preparatory phase, and this is when food or drink is put into the mouth. It is mixed with the saliva in the mouth, and it becomes a small ball of food, which is known as a bolus. And then the second phase is the oral phase, and this is when the tongue pushes the ball of food or the bolus of food or drink into the back of the mouth. The third phase is the pharyngeal phase, and the bolus or the ball of food passes from the mouth into the throat and down the esophagus, and then the airway closes during this swallowing process to prevent food from going into the airway. And then the fourth and final phase is the esophageal phase, and this is when the ball of food or the bolus passes through the esophagus into the stomach. So those are the four phases of swallowing. And this is a picture of normal swallow function. So let's going to start on this side. As you can see, this is going to be the mouth. So you put the food into your mouth, chew, and then it forms this ball of food or this bolus, okay? So this is your nose pipe. As you are eating or chewing, you are breathing in through your nose, and the air that you are breathing in goes down into your esophagus. So this is your air pipe, or this is your windpipe, your trachea, and this is where your air is going to go. Over here on this side, this small little opening, this is your esophagus. So when you swallow this green bolus of food, this little piece is known as the sphincter. It closes. So this flap folds down, and as you can see, it's folding down as the food passes from your mouth into your esophagus. That way, your airway closes, so food does not enter into your airway. It goes down into your esophagus. and then after the food goes into your esophagus completely, this little flap opens back up again, and then you start breathing in through your nose, and then your air goes into your airway. So this is a normal swallowing function. However, someone with impaired swallowing function or dysphagia, when they are swallowing, the food that little opening may not close properly, and so this is on the side normal swallowing function. And someone with an impaired swallowing function, the food may go into the trachea by mistake. So this is what is going to classify dysphagia as when food is not, entering the esophagus correctly, if it's going into the trachea. And this ultimately, the trachea leads to the lungs. So individuals are then at risk for swallowing food or liquids that are going to go into the lungs instead of going into the stomach. So what are the complications of dysphagia then? So number one is going to be choking. So if you're swallowing food and it's going into your airway or your trachea, then into your lungs, that can cause choking. It can also cause malnutrition or weight loss. So individuals may be, swallowing less because the risk of choking, and a lot of times patients, if they're constantly choking, they may be afraid to eat because it's, causing them to cough. It can also cause dehydration. So if they have a complication of swallowing liquids, then they're at risk of dehydration. And if food or liquid, continually goes into their trachea and down their windpipe and into their lungs, it can cause aspiration pneumonia. So this is a big complication that we see with individuals who have dysphagia. So what are the risk factors of dysphagia? Well, natural aging process can occur. So, over time, as you can imagine, if we swallow 600 times per day after so long of a time period, those muscles start to not properly function anymore. And so just normal wear and tear on the esophagus can cause an increased risk for dysphagia. And then, individuals who are also older are at a greater risk of other medical conditions which can cause dysphagia. So strokes are going to be a major risk factor. As we age, the risk of strokes increases, and so this can increase the risk of dysphagia and impairment. And then just a greater risk of swallowing difficulties from those medical conditions. Other health conditions such as autoimmune issues, in which it can impair the swallowing function, muscles involved in swallowing function, such as neurological conditions. And then nervous system disorders as well can increase the risk of swallowing issues. So what are the causes? There are lots of causes of dysphagia, so I just will two different classifications. One is going to be mechanical, and this can either be from a trauma to the esophagus or any other of those muscles, any other areas of those muscles, or it can be a surgical issue that has impeded the ability to swallow properly. And then the second classification is going to be a paralytic. So as I mentioned, strokes can paralyze those muscles involved in the swallowing process. So the causes can be a head injury, so an individual who has had a traumatic brain injury, if those nerves are not properly functioning, then that can cause issues swallowing. Dementia, as I mentioned, as individuals do get older, the risk of dementia does get higher with age, and so one of the complications of dementia is not knowing how to properly swallow anymore. And then Alzheimer's as well is going to go along with dementia. Stroke, as I mentioned, when we have a lack of oxygen to the brain, that can cause neurological disorders and can subsequently cause, the lack of muscles to function properly in swallowing. HIV and AIDS does also increase the risk of dysphagia, specifically in the later stages of HIV, AIDS, or even in acute stages. Some patients will have issues with infections of the mouth and tongue, so that kind of impairs their ability to chew and swallow properly. Intellectual disabilities as well impede swallowing. And then poor dentition, which is your teeth. So someone who has, very little teeth, or if they wear dentures, if their dentures aren't fitting properly, they're not able to properly chew their food. So a whole line of issues can come under having poor teeth. And then cancer as well, which would include surgical resection. So someone who has cancer, if they, specifically head and neck cancer, if they're getting radiation to this area, the radiation ends up a lot of times impairing the muscles that are involved in the swallowing, and so sometimes patients are not able to swallow properly. Or if they have a surgical resection, so a surgical resection of any part of the esophagus, tongue, that can impair swallowing as well. And then we have myasthenia gravis, which is a neurological disorder, a brain tumor as well, so a brain tumor that is pressing on an area of the brain that is involved in the swallowing, the muscles that are involved in swallowing. Multiple sclerosis, again a neurological disorder that affects the muscles. Parkinson's disease, another neurological disorder that impairs the muscles functioning properly. And same thing with Huntington's disease. So a whole list of causes of dysphagia can occur. So what are the signs and symptoms? And these are signs and symptoms that is important for you guys to be able to recognize as well, because a patient may be on a regular diet or they may not have a modified textures that is ordered. So if you see signs and symptoms reoccurring in patients, definitely something to look out for, and to discuss with the nurse and let someone know if you see these signs and symptoms happening in a patient, or unless a patient explains to you that they're having issues. So excessive drooling or regurgitation, like I said, our mouth, we create a lot of saliva. So if you see excessive drooling, that means that the patient is not able to swallow the saliva properly. And so they may be drooling, and then regurgitation is going to be, the reflux of food. So food is not going down the esophagus properly, and that means it's coming back up. Pocketing of food in the mouth. So pocketing is when you chew your food and then you end up, pocketing it on the side of your cheek. So you're not actually swallowing it. It may just be sitting in your mouth and it's not going through the process of going to the back of your mouth and swallowing properly. Choking or coughing, like I said, when food or liquid goes into the windpipe instead of down the esophagus, a patient may be choking and coughing frequently. Gargle or hoarse voice or gargling. So again, this is going to be caused from food or liquid repeatedly going into the air pipe instead of going down into the esophagus. Frequent clearing of throat. So again, when someone is swallowing food or liquid and it is continually going into their trachea or their windpipe instead of going into their esophagus, they may be trying to clear their throat repeatedly to try to clear out whatever residue is stuck in their windpipe. And then patients sometimes may complain that they're feeling a lump in their throat. So if they're not swallowing properly and the food is, getting stuck, then they may complain that they're feeling something being stuck in there. And then the last thing, food remaining on the tongue after swallowing. So if a patient is, chewing and swallowing, and then you oftentimes see food remaining on their tongue after they're finished their meal, that's a sign that they're not pushing the food back to the back of their mouth properly and swallowing it. Excessive mouth movement during chewing and swallowing. So if someone is taking a long time to chew their food because they're having difficulty pushing the food back. And prolonged mastication goes along with excessive mouth movement. Mastication is the actual chewing. So if they're taking a long time to chew their food, it could be a sign that A, they have poor dentition, so they may need softer foods, or B, they're just not able to get the food to the back of their mouth to swallow properly. Poor food intake, if an individual is not eating well enough, and maybe because they are not able to consume the food that they are currently prescribed. And this can result in malnutrition and dehydration as well. And then lastly, reoccurrent pneumonia, reoccurrent fevers can be a sign of dysphagia as well. So there are 3 levels for the texture diets that can be described. The first level is puree. So this is going to be the most restrictive diet. We're going to get into all of these different types of diets in depth. The second level is dysphagia mechanically altered, and this is, in between the first and the third. So the third one is dysphagia advanced or chopped. So these are going to go in order from most restrictive, middle restrictive, and least restrictive diet. So let's get into puree. So this is a picture of puree food. So as you can see, it is blended very well. And the food is going to be a very smooth consistency. So food is either processed in a food processor or a blender to make it smooth. The food is going to be thick, smooth, and very moist texture. That way it's easy to get down, and the food does not have any pulp, food particles, or solid food pieces. And it's really the texture of baby food. That's what it is going to relate most to. So with the puree diet, it does not require any biting or chewing. So again, this is going to be smooth texture that does not require any kind of chewing or biting. And it cannot be drank from a cup or sucked through a straw. It is typically going to be consumed with a spoon, just as you would imagine baby food, the same kind of technique. So the puree diet, we're going to go over the food groups and then the foods allowed and foods not allowed for each food group. So for meat and meat substitutes, all the meats are going to be pureed meats. So they're either going to be blended in the food processor. Typically, depends on the hospital, they might do it on site where they blend it up, or maybe prepackaged pureed meats. Pureed eggs are going to be either in the blender or food processor, or they're already going to be done ahead of time. Soufflés, hummus, pureed beans, which is basically hummus, and then any types of casseroles are going to be pureed as well. They're going to be lump-free. The foods not allowed on the puree diet are going to be regular or chopped meats or casseroles. These, typically regular and chopped meats or casseroles are going to have chunks in them, so those are not going to be allowed on puree. Cheese slices or cubes are not allowed. Peanut butter, although peanut butter is smooth, it is a sticky substance, and so it is not easily brought down into the esophagus. Sandwiches that require, biting, so sandwiches are going to be excluded. Pizza, hard-cooked eggs as well. For vegetables, all vegetables will be pureed with no chunks, lumps, pulp, or seeds. So tomato paste or sauce without any seeds is fine, and then mashed potatoes with gravy is also fine. The foods not allowed in the vegetable category is going to be no fresh or uncooked vegetables, including frozen or canned corn, celery, onions, peppers, lettuce, cabbage, cucumbers, peas, sliced tomatoes. So if any of these foods are included, they will have to be blended. So no fresh or uncooked vegetables from these categories. And then no non-pureed or non-smooth cooked vegetables. So all vegetables will need to be A, cooked, and B, in a puree smooth texture. For fruits, applesauce is allowed, and then well-mashed bananas. So whole bananas are not allowed to be given. The bananas need to be nice and ripe, and they need to be mashed up completely in an applesauce or puree texture. Any canned fruits or soft cooked fruits are allowed as long as they are in a puree form. And then fruit juices are allowed if a patient is allowed to be on thin liquids, which we will get into. The foods not allowed, patients on puree diet cannot have any fresh, frozen, or canned fruit, grapefruit, or pineapple. So all fruit needs to be cooked and pureed. And then pineapple and grapefruit are more fibrous fruits, so typically those are not going to be allowed even if they are blended up. So for grains and breads, all bread will need to be in a puree mixture. Cooked pasta, rice, and noodles must be pureed to a thin consistency. And then there's a mixture of gelatin water that can be added to puree food to help thicken it up more. And then farina type cereals with pudding-like consistency. So very smooth cereals can be cooked and then pureed to pudding-like consistency. Foods not allowed are going to be coarse cooked cereals or dry cereals, cereals with nuts or seeds, all breads, crackers, regular rice, oatmeal, and muffins. Because all of these food items are going to require, some type of chewing or biting, so those are not going to be allowed. Soups. Smooth cream soups or broth type soups with pureed and strained ingredients are fine. So if there are chunky soups, all chunky soups must be pureed until they are completely pureed texture, and then they must be strained as well to filter out any lumps or chunks. And then soups not allowed are going to be any type of regular soups with rice, corn, peas, and large chunks of meat and vegetables. For desserts, smooth custard or pudding is allowed, plain or custard yogurt, desserts that are pureed to a smooth and moist consistency. So cake can be pureed to a smooth and moist consistency, but again, it has to be moist enough so it's easy to go down. Ice cream, sherbet, frozen yogurt is allowed if thin liquids are allowed, and we'll get into the liquids part. Regular cake, pies, cookies, bread, and rice pudding, fruited yogurt is not allowed because it's going to have harder chunks in it. And then for the fats, butter, margarine, smooth gravy, cream sauces, mayonnaise, salad dressings, cream cheese, sour cream, and whipped toppings are allowed. Any fats that are excluded are going to be coarse or chunky additives, so nothing that has chunks or coarsey components to it. And then miscellaneous items, sugar, jello, honey, syrup, ketchup, mustard, and smooth sauces are allowed. Jams with preserves are not allowed because they have seeds in them, and then any coarsely ground spices are also not allowed. So this is an example of a puree menu. For breakfast, someone could have orange juice, cream of wheat. So cream of wheat is typically going to be that pudding-like texture. Pureed scrambled eggs, biscuit that has been flurried. So again, it's like a pureed biscuit. Margarine, jelly, milk, coffee. For lunch, a patient could have pureed chicken, mashed potatoes with gravy. Again, those mashed potatoes are going to be pureed texture, so no lumps. Pureed carrots, pureed peas, margarine, pudding, and tea. And then for dinner, pureed beef, pureed pasta, pureed green beans, tomato juice, pureed peaches, margarine, and milk. Next, we're going to move on to mechanically altered diet. So foods are going to be soft and moist. Biting is not required, however, minimal chewing is required. So as you can see from this picture, it is a little bit higher texture than the pureed food, but it is still very soft looking. So this type of food easily forms that cohesive bolus or that ball of food in the mouth. And all the meats are going to be moistened ground meats, no larger than 1/4 inch large, so very small pieces of meat are allowed. Vegetables have to be cooked to a soft mashable texture, and soft cooked or canned fruits and bananas are allowed. So we're going to get into the meats and meat substitutes. As I mentioned, no more than 1/4 inch thick. So tender meat, fish or poultry, moist ground meat, soft casseroles, melted cheese in casseroles, tuna or egg salads, as long as they are that small texture, cottage cheese, a smooth quiche, scrambled eggs, well-cooked legumes that are mashable, and then baked beans as well are allowed. The foods that are not allowed, no dry meats, tough or rubbery meats, bacon, sausage, hot dogs are not allowed, dry casserole with rice or large chunks are not allowed, no cheese slices or cheese cubes, no peanut butter, hard-cooked eggs, or pizza. For the vegetables, vegetables must be soft cooked, easily mashable, that are less than 1/2 inch in size. They must be well cooked, slightly mashed baked beans, well cooked and moistened broiled, baked or mashed potatoes, so very soft potatoes. Well cooked shredded hash browns that don't have that crisp to it. Soups that are easily chewable with easy to swallow meats and vegetables. Foods that are not allowed are going to be cooked corn, raw vegetables, potato skins, potato chips, fried potatoes or vegetables, and then more fibrous vegetables are typically not allowed. Again, this is going to depend on the facility. But broccoli, cabbage, Brussels sprouts, and asparagus are typically more fibrous and more difficult to chew. And then soups with corn or any large chunks are not going to be allowed. So grains and breads that are allowed on mechanically soft, we have soft breads, rolls, biscuits, plain muffins. Rice is going to depend on the facility. If the rice is soft and fluffy and they have approved it to be mechanically altered safe, then that's fine. But some rice is cooked that it's not soft, and so that may not be allowed in some facilities. So it just depends. Soft pancakes that are well moistened with syrup or some type of sauce. Crackers that are softened in soup, so they have to be soft. Cooked cereals such as oatmeal, moistened cold cereals, so cornflakes, Rice Krispies, and Wheaties are allowed, but again, they must be soaked in the milk prior to, so they become nice and soft and, minimal chewing required. And then pasta is also allowed, that it has to be in a sauce, and then the pasta is going to be in smaller pieces, so it does not require much chewing. Grains and breads that are not allowed are going to be coarse cooked or whole grain dry cereals, cereals with seeds, nuts, or dried fruit, such as shredded wheat or all bran, because these cereals are very hard texture. Plain dry bread is not allowed. Toast or tough bread, thick pizza crusts, or any hard crackers are not allowed. For the fruits, any soft, drained, canned, or cooked fruits without seeds or skin. So peaches must be peeled, pears must be pared, soft or ripe bananas are allowed. Fruit cocktail is allowed because fruit cocktail is nice and soft. Gelled cranberry sauce, and then fruit juices are allowed if thin liquids are permissible. Foods not allowed are going to be fruit with tough skin, so apples and dried fruit are typically going to be excluded because they are more tough. Strawberries and grapes are also not allowed. The strawberries may depend on the facility, but typically strawberries, especially raw strawberries, are more tough, so that may not be allowed. But definitely grapes are not going to be permissible. Grapes are a high choking risk. So for fats, same thing as I mentioned for the puree: butter, margarine, gravy, cream sauces, mayonnaise, sour cream, whipped toppings. Fats excluded are going to be any fats with chunky additives. And then peanut butter, again, is going to depend on the facility. Some facilities allow peanut butter, depending on the texture of the peanut butter. Some facilities do not. But in general, peanut butter is typically more sticky, and so it has a higher risk of getting stuck in the esophagus. For desserts, custard, pudding, ice cream, sherbet, and gelatin. Soft fruit pies with bottom crust only, so no pies that have the top crust are allowed, because typically that bottom crust has become nice and soft since the fruit and the additives has been sitting on top of it. Crisps or cobblers without seeds, nuts, coconut, with soft bread and crumb mixture, so no really crispy cobblers, they must be really soft. Soft moist cakes, soft moist cookies, and then any kind of chocolate that is very smooth and easily chewable will be allowed. No hard chocolate bars. Foods not allowed are going to be with ice cream, sherbet, frozen yogurt. If thin liquids are allowed, then these foods can be given. But if thin liquids are not allowed, they will not be able to be given. Dried cookies or cakes are not allowed, and then anything with nuts, seeds, pineapple, or dried fruit will be excluded. Miscellaneous items, jams or preserves without seeds. Soft candies may be given, again depending on the facility. Most soups will be allowed, and then foods excluded will be seeds, coconut, and nuts. Sticky or hard foods, soups with tough meats or vegetables, and then chips or any other hard snack foods. So chips, pretzels, foods like that are require chewing and are tough will not be permitted. So a mechanically altered menu, we have orange juice, cream of wheat, scrambled eggs, applesauce, margarine, jelly, milk, coffee. For lunch, it's going to be a honey glazed chicken that is ground. So the chicken is going to be ground up into that small texture, no more than 1/4 of an inch. Buttered potatoes, soft cooked carrots, margarine, and then a frosted banana cake, so nice and moist cake, milk, and tea. For dinner, braised beef with gravy, which is ground, soft cooked noodles with gravy, soft cooked green beans, so again your Vegetables are going to be mashable, peach slices, pudding, and iced tea. And the last diet we have is the advanced diet, or the chopped diet. So as you can see, these food textures are a little bit bigger than the ground meat or the mechanically altered textures. So this is for patients with mild dysphagia. Some patients who may not have teeth, they may be, able to consume advanced or chopped diets that, requires a little bit of mastication, but not a whole lot. And it does require more chewing than the puree or mechanically altered diet. So the food pieces are moist, bite-sized pieces of food, and includes textures from both puree and mechanically altered. So the meats or meat substitutes that are allowed are going to be tender meat, poultry, soft cheese, chopped or ground meats, chopped or ground poultry, soft casserole, chicken, egg, or tuna salads. Most types of eggs will also be allowed, smooth peanut butter, and then yogurt without nuts or coconut. For the foods not allowed, dry or tough meats such as bacon, sausage, hot dogs, chunky peanut butter. Vegetables that are allowed, tender, soft cooked vegetables, vegetable juices, soups, shredded lettuce is also allowed, fried, mashed, or baked potatoes. The vegetables not allowed are going to be any raw or cooked vegetables with tough skins or seeds, and any potatoes that are tough or crisp. For the fruits, ripe bananas, ripe melon, peeled peaches, and pears are allowed. And then any cooked, frozen, or canned fruits are also allowed. And soft berries can also be given now. Foods not allowed typically are going to be grapes, cherries, or apricots with skin. And then pineapple, again, pineapple is going to depend on the facility. If it is a fibrous, tough texture, some facilities may not allow it, but it's just going to depend on the facility. So grains and breads that are allowed, most cooked cereals, well-moistened dry cereals, pasta, noodles, and rice. Again, the rice is going to vary from facility to facility depending on how they cook the rice and if it's soft enough to be given. Moist bread dressing, well-moistened soft cakes, rolls, pancakes, muffins, and biscuits will now be allowed. Foods not allowed will be cereals or breads with raisins or grains. Typically granola type cereal, since granola is going to be a harder texture. Coarse or dry cereal such as shredded wheat or all bran. Thick crust bread, so French bread or baguettes are not going to be given because they are going to be more difficulty to chew. And then crackers as well. Again, crackers is going to vary in the facility. Some may allow it, some may not. Fats, the only fats that are going to be excluded are going to be fats with coarse, difficult to chew, or chunky additives. Same thing with the previous diets. For desserts and candy, cakes, tender cookings, custard, pudding, ice cream, sherbet, frozen yogurt, and then still pies with bottomless crust only will be able to give in, so no pies that have that top layer crust. Desserts that are not included will be any desserts containing nuts or coarse dried fruit or tough fruit, and then desserts that are baked to a hard consistency. And then miscellaneous items, so soft candies are typically allowed, jelly, jams, all sauces, any candies, and then for candies that are excluded or miscellaneous items that are excluded, candy containing tough fruits, coconut or nuts, hard candy, and then chewy caramel and taffy is not allowed because it has that sticky substance that, again, it's more difficult to get down. And an example of advanced or chopped diet menu. So for breakfast, someone could have orange juice, dry cereal moistened in milk, scrambled eggs with cheese, with cooked vegetables, so like a scrambled vegetable with cheese dish, banana coffee. For lunch, tender beef stew in small chunks, a dinner roll with no seeds, canned fruit salad, yogurt without nuts or seeds, a soft baked cookie with no nuts, and then tea. For dinner, a patient could have moist chicken breast with gravy, creamy potato soup, a dinner roll with no seeds, soft cooked green beans, butter, and then a moist cake with ice cream, and then milk. So next we're going to move on to the liquid consistencies. So there are 4 types of consistencies. The first one is going to have thin, nectar, honey, and pudding. So these are in list from least restrictive to most restrictive, or the thinnest to the thickest type of liquid. And we're going to get into all of these in detail. So thin liquids is non-restricted consistency. So it's going to include all liquids, including foods that melt. So Italian ice, ice cream, broth, and soups are allowed to be given when someone is on thin liquids. Someone who is not on thin liquids is not going to be able to be given anything that melts, because when it melts it becomes this thin consistency. So something to be very cautious of. If someone is not on thin liquids, then they are not able to be given these types of foods, since they do melt to a thin consistency. Nectar thick is the second type of thickness. And it is, if you think about an apricot or a tomato juice consistency. So if you think about the tomato juice, it is a little bit thicker than water, so this would be considered a nectar thick. It does require a thickening agent, and the liquids are going to run freely off of the spoon, but it does leave a thin coating on the spoon. So types of liquids include vegetable juice, chocolate milk, cream soups, thickened liquids, and then you want to avoid liquids that melt, as I had mentioned. So ice cream, popsicles, sherbet are going to be excluded. The third type of liquid is going to be honey thick, and this type of liquid is going to be thickened to a consistency of honey. So if you can imagine, pouring honey onto a spoon, it's going to look something like this picture. So it's going to be a much thicker consistency than the nectar or the thin liquids. And liquids can be poured, but they are going to be very slow. So if you imagine putting honey on a spoon and pouring it, you know how slow it comes off of the spoon. So honey thick liquids do require a thickening agent. There is no liquid out there besides honey that is naturally in this thickness. So all drinks are going to require a thickening agent to be added to them. And food or drink slowly drips in dollops or blobs off of the end of the spoon. And then you want to, again, avoid all liquids that melt. So the final texture is going to be pudding thick texture. And this type of liquid is going to be consumed with a spoon. It cannot be drank from a cup or sucked through a straw because it is too thick. Food is going to sit on the spoon and does not flow off of it. So if you imagine, putting pudding on a spoon, typically it just sits there. It doesn't flow off of the spoon, as you can see in this picture. It cannot be poured, and it requires a thickening agent. So again, you want to avoid liquids that melt, so ice cream, popsicles, any food item that melts to a thin liquid consistency must be avoided. And there are some commercially pre-thickened beverages such as juice and milk that you may be familiar with. So this is an example by Hormel. It's called Thick and Easy. It is an apple juice, and this is the consistency of a honey texture. So if a patient is on a thickened liquid and you are grabbing one of the pre-thickened beverages from the fridge, you have to check the label to see what the consistency of it is. So see whether it's regular consistency, nectar thick, honey thick, or pudding thick. So very important to pay attention to the type of consistency that drink is. And all of these pre-thickened beverages are available in nectar, honey, and pudding thick. And then if the facility may have both, they may have pre-thickened beverages or they may have a commercial thickener that individuals can add to beverages to thicken it. So some types of commercial thickeners are going to be Thickened, Thick and Easy and Thicks. So this is an example of a Thick and Easy brand. And if the drinks are not pre-thickened, then that would require an individual to thicken them themselves. So I think it depends on the facility. At my facility, the catering associates or the individuals who help out in the kitchen do not thicken it. This is going to be the nurse's job, so it could be the nursing assistant's job or the nurse's job. But it is important to pay attention to, how to thicken items properly. So this is just an example if you do have to thicken an item to a proper consistency. So we have thin nectar, honey, and pudding consistency. So this is going to be just an example of the additive that you're going to add to the food or beverage. So for instance, if we are giving a patient juice, we are going to do 2 scoops of this, and then you are going to stir it. So, you're going to stir that liquid pretty vigorously, and then you're going to let it stand for 2 minutes. That when it stands, then that's when it really thickens up properly. And then if you were giving a patient a juice of a pudding consistency, you're going to do 4 scoops of this additive and then let it stand for 4 minutes. Liquids that contain fat or protein, you may need to stir them more vigorously. And these are the mixing instructions. So you're going to choose the desired amount, whether 1 scoop, 2 scoop, or 3 scoops, and you are going to add it to the empty glass, and then you are going to pour the juice or whatever liquid on top of it, and you're going to stir it as you pour it into the glass. You're going to stir it pretty briskly with a fork or a spoon for 30 seconds to a minute, and then you're going to let, if it's a thin liquid starting out, if it's water, juice, you're going to let it stand for 1 to 2 minutes before serving. If it is a milk or an oral supplement, you have to let it stand for 3 to 6 minutes for it to approve or to get to the desired thickness. So for commercial thickeners, which is the ones that I just went over, you're going to use a mixing chart for the guidelines on the amount of thickener that you need to add, the amount of time you need to stir it, and then the standing time for the desired thickness. It is very important that you do not under thicken liquids. So it is better to have a liquid that is too thick than to be too thin, because again, with dysphagia, it is more likely that a patient is going to have aspiration with a thin liquid than with a thick liquid. So it's always better, if you're not sure, to always over thicken it than to have the liquid be too thin and risk the patient aspirating and it going down into the lungs. So some special considerations for those with dysphagia. Fluid intake is often limited in those who are unable to swallow thin liquids. So as you can imagine, it's not ideal to have to swallow water or any type of juice that is in a thickened consistency, because it's just not something that we're used to. So fluid intake is often going to be reduced in individuals who are on thicker liquids. This can, lead to an increased risk of dehydration. So just something to pay attention to if someone is on thickened liquids. Monitor how much they are drinking. And for general purposes, if you are feeding a patient who is on a modified food texture, it's good to alternate between liquids and solids. So feed them a bite of solid food and then switch to some liquids. Go to solid food and then liquids. This way you are alternating and helping with the movement of the food down into the esophagus and down into the stomach. And if a patient is having difficulty eating, ensure that they are in a quiet atmosphere, free of distractions. So this will help them really focus on their meal, and instead of being distracted by other movement or other voices in the area, make sure that if they're having a difficulty eating, that they're in a quiet atmosphere. And then also ensure that the patient is comfortable as well in the environment that they are in. Some patients may also be instructed to sit in an upright position and with their head slightly bent forward. So when swallowing, some patients, they may be instructed by the speech and language pathologist to be sitting upright, and then when they swallow, they tuck their chin. This helps facilitate the movement into the esophagus instead of having food or liquid go into their trachea and causing aspiration. So just something to be aware of if this is the instructions that are given. This way it helps to close the glottis, or that little flap that is that closes during swallowing, and this can help reduce the risk of aspiration. And after eating, patients should remain in an upright position for 15 to 30 minutes after meals to prevent aspiration, because we don't want food to come up. If they're at an aspiration risk, if they regurgitate, it can, it may cause food to go into their air pipe. And now we are going to move on to the questions for the day. So we have 10 questions we're going to go over. Question 1 is, which of the following is not a complication of dysphagia? So we have A, choking, B, headache, C, weight loss, and D, aspiration pneumonia. I'll give you a minute to answer. So the answer is B, headache is not a complication of dysphagia. Someone who has dysphagia, you may see that they are choking, they have weight loss, or that they have pneumonia from aspiration. Question 2, impaired swallowing can cause food and or liquid to enter where? A, the nose, B, the blood, C, the lungs, or D, the heart. And I'll give you a minute. So the answer is C, the lungs. When an individual has impaired swallowing, the food is going to not go down into the esophagus correctly. It can go into the windpipe or the trachea, which leads to the lungs and which can cause aspiration pneumonia. Question 3, what are the 3 levels of modified food textures in order from least restrictive to most restrictive? A, advanced or chopped, mechanically altered, and puree. B, puree, mechanically altered, or advanced and chopped. C, advanced or chopped, puree, and mechanically altered. And D, mechanically altered, advanced or chopped, and puree. So least restrictive to most restrictive. The answer is A. So advanced and chopped is going to be the least restrictive. It's just going to be, require a little bit of chewing, and then mechanically altered requires minimal chewing, but it still is going to be that ground meat. And then puree is the most restrictive because everything has to be in a puree form. Question 4, what fruit is allowed on the puree diet? A, canned peaches, B, a whole banana, C, grapefruit, or D, applesauce. So the answer is D, applesauce. Applesauce is the only pureed fruit on here. So canned peaches are going to be, if they're not pureed, then they're not going to be allowed. Whole banana is not allowed. If the banana is mashed up or in a pureed texture, that would be able to be allowed. Grapefruit is not allowed because it is a more fibrous texture. So the only food or the only fruit that can be given is going to be applesauce in the puree form. Question number 5 is, what meat is not allowed on the mechanically altered diet? We have A, ground beef, B, tender fish, C, tuna salad, or D, sausage. So the answer is D. Sausage is the meat that is not allowed on the mechanically altered diet. Ground beef is fine as long as it's in that 1/4 inch texture. Tender fish is going to be nice and soft and require minimal chewing. Tuna salad is fine because, again, it's going to be in this coarse or this really small non-coarse texture, so it will be easily require minimal chewing. But sausage is not allowed. It's going to be too tough and too large to consume. Question 6, what vegetable is allowed on the mechanically altered diet? We have A, green beans, B, cooked corn, C, salad, or D, raw carrots. So the answer is A. Green beans are the only vegetable listed that is allowed to be on the mechanically soft diet. Remember, mechanically soft diet requires that vegetables are going to be in a mashable texture. So green beans, if they are cooked well enough, they will be mashable. Cooked corn is too tough and fibrous. Even if it's cooked, you can't mash it to its a smooth consistency. A salad is obviously not cooked food, so it's going to be too tough to consume. And then raw carrots are definitely going to be too tough. If the carrots were cooked in a very nice soft texture and they were mashable, then they would be allowed. But from here, green beans are going to be the only ones soft enough to be able to be in a mashable texture. Question 7, list liquids from least thickened to most thickened. We have A, thin, nectar, pudding, and honey. B, nectar, honey, thin, pudding. C, thin, honey, nectar, pudding. And D, pudding, honey, nectar, thick. So the answer is B. The textures from least thickened to most thickened are going to be thin is going to be your least thickened, no thickening at all. And then nectar is going to be the next thickened. Honey is a little bit thicker than nectar. And then pudding is going to be the most thickened liquid. Question 8. What is an appropriate meal option for mechanically altered and nectar thick liquids diet? We have A, scrambled eggs, oatmeal, a soft or ripe banana, and chocolate milk. B, toast with butter and jelly, chopped bacon, blueberries, orange juice. C, soft pancakes with syrup, sausage, yogurt, cranberry juice. And D, granola with yogurt, grapes, shredded hash browns, and coffee. So the answer is A, scrambled eggs, oatmeal, soft banana or ripe banana, and chocolate milk. So scrambled eggs are going to be mechanically soft, same thing with oatmeal, and then a ripe and mashed banana is mechanically altered. And then the nectar thick liquids, chocolate milk, is allowed. The reason why B, C, and D are not allowed is toast is not going to be allowed on a mechanically altered diet, nor is chopped bacon or blueberries. Orange juice would need to be thickened. Soft pancakes are allowed on the mechanically altered diet, but sausage is not allowed, and the cranberry juice would need to be thickened. And then D, granola and grapes are not allowed on the mechanically altered diet. Shredded hash browns are allowed, and coffee would need to be thickened to nectar thick. Question 9, true or false? It is safer to under-thicken liquids than to over-thicken liquids. A, true, or B, false? The answer is B, false. So it is typically safer to over-thicken liquids to prevent the risk of aspiration of liquids that are too thin. And question 10, which of the following techniques should be used for a patient with dysphagia? A, alternate solid and liquids when feeding. B, sitting in an upright position. C, a quiet and distraction-free environment. Or D, all of the above. And the answer is D, all of the above. So all of these techniques are going to be useful for a patient who has dysphagia. And that concludes today's presentation. Thank you so much and have a wonderful day.